The honourable member for Dartmouth North.
Mr. Speaker, my question is for the Minister of Health. Truvada is a drug used in the treatment of HIV. Individuals diagnosed with HIV are eligible for full coverage of this medication. Recent research has shown that when taken daily as PrEP, the drug is 98% effective for the prevention of sexual transmission of HIV and 70% effective for the prevention of drug injection transmission of HIV. Evidence from other jurisdictions have shown that universal coverage results in significant decline in new HIV diagnoses. British Columbia, Alberta, and Saskatchewan all provide universal coverage for PrEP. Mr. Speaker, will the Minister of Health agree to include universal coverage for PrEP in the upcoming budget?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I thank the member for raising this important question. As members of the legislature may be aware, the province began covering PrEP as part of our formulary earlier this year, as part of our pharmacare programs. Mr. Speaker, as part of that announcement, one of the commitments we made was to engage in continued consultations to look at what else, other types of work and what role further coverage may include. So, Mr. Speaker, that work has been ongoing with our, I believe, our primary health care team, Mr. Speaker. As far as what's in the upcoming budget, I think the member can wait a couple more weeks.
The honourable member for Dartmouth North.
I can't, Mr. Speaker. I need to know now. Mr. Speaker, as of June 2018, Nova Scotia had 16 new HIV infections, double the expected numbers. Members of the PrEP Action Team have said that adding PrEP coverage through family pharmacare will have little to no impact on HIV rates in Nova Scotia, since many who would benefit from PrEP will not be able to afford the hundreds, if not thousands of dollars in co-pays required before provincial support kicks in. Mr. Speaker, universal coverage for PrEP would require a $1.5 million annual investment. This is just over the lifetime cost of HIV-related health care for one person. Mr. Speaker, does the minister agree it would make better sense and better investment in preventative medicine than to continue to pay the cost of rising infection rates?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and the member raised a very important piece of information for this legislature. For the members that aren't aware, with the increased number of HIV infections that we've seen in this past year, the vast majority of the increase has been seen actually in the area of drug use transmissions, Mr. Speaker. That raises another very important question and challenge that we face. It goes back to our commitment and our efforts, Mr. Speaker, to provide more treatment options as well within the drugs addiction space to help reduce those and avoid some of those other risk factors that are at play to avoid those increased transmissions and infections.